Dear audience, dear chair, my name is Petra Papócsi and my PhD topic are the fixation techniques used in the therapy of jaw fractures. I'm an oral surgeon and a PhD student at Department of Oral Maxillofacial Surgery and Stomatology. My SMSc is Kata Kelemen and my supervisor is Zsolt Németh. My vision is to learning and utilizing the latest techniques in case of patients with jaw fractures, and my mission is to using a faster and more comfortable method during the night duties for splinting. You can see here my specific goals. At first, I would like to investigate the effectiveness and safety of the currently used fixation methods in treatments of jaw fractures, and my second topic are the maxillofacial injuries related to the e-scooter usage. You can see here my first topic again. It's a systematic review and the network meta-analysis. In case of jaw fractures involving the dental occlusion, we have to re-establish the occlusion with the IMF. The MMF is the same. It's the intermaxillary fixation and the maxillomandibular fixation. It's important for us because the mandibular fractures are the second most frequent facial injuries, more common in males in their 20s. And the fractured ends must be fixed because absence of the proper bone healing, like you can see in the picture, there could be bite, functional and aesthetical differences and inflammation as well. The fixation can be in a conservative way with a close reduction and in a surgical way with internal reduction and fixation. On the first picture, you can see the Eric arch bar. It's the gold standard technique for IMF. We can see two arch bars fixed by interdental wiring. It's really time-consuming method and really painful for the patient. Can cause many gloves and needle stick injuries, and the oral hygiene maintaining is really hard with that. So that's why they started to use the IMF screws with self-tapping screws or 4-point fixation in another name. It's shorter and easier to use and applicate, and it's better for the patient as well, but we can cause many iatrogenic injuries, for example, tooth vitality loss or root injuries. That's why they started to use the hybrid technique to see all the advantages of the two other techniques. Our clinical question was that is there any difference in effectiveness and safety between the currently used methods in treatments of jaw fractures. Our population were adult patients with jaw fractures who need the IMF. Our intervention and comparator were the Eric arch bar, the IMF screws and the hybrid MMF, and you can see on the table the main outcomes, but we have more. And we would like to see that which technique is the most time efficient and safe for the doctors and patients as well. These are my systematic search, which was conducted in 4 main databases, and you can see here my final search key. At first, we had more than 20,000 hits, and after the selection, citation, chasing, and references, we have now 29 eligible full text. We have divided the outcomes into safety outcomes and efficacy outcomes, and the statistician has analyzed them for only RCTs, and for RCTs with non-RCTs together. Due to time constraints, I would like to talk about only two main outcomes, which was analyzed for RCTs. At first, from the application time, which was measured in minutes. On the left side, you can see the network plot where the dots are the treatment types and the lines are the comparisons. And on the right side, you can see the P-score ranking. The random P-score shows so if that number is higher, the treatment is better. So we can see that in case of application time, the most time efficient were the IMF screws, followed by the hybrid MMF technique, and the most time consuming were the Eric arch bar. On the leak hit table, we can see the values of the point estimates and the confidence intervals, and it represents that to apply the IMF screws is about 47.33 minutes less than the Eric arch bar, and the application of the hybrid technique is about 33.44 minutes less than the Eric arch bar. These results are statistically significant and clinically relevant as well. My next outcome would be the iatrogenic injuries, which are the tooth vitality loss or, for example, the root injuries, which were caused by the screws. On the left side, you can see the network plot again, and the P-score ranking shows that the safest technique were the Ericard bar, because there are no screws, followed by the IMF screws, and the last one was the hybrid MMF technique. On the leakage plot, we can see that the Ericard bar can cause the third part of the iatrogenic injuries than if we use the IMF screws. And if we use the Ericard bar instead of the hybrid technique, there could be the fourth part of injuries, and these are clinically relevant and statistically significant values as well. I would like to show a simplified table of the cost analysis because this analysis was limited, so we couldn't make a meta-analysis for it because of inflammation and regional differences. So at first, after the collection of the data, we have converted everything into US dollar and then to 23 US dollar. And we could see that the average price of the Ericard bar was $60, and the average price of the IMF screws were 6 times higher. However, the average price of the hybrid technique was 20 times higher than the Ericard bar. The strength of our meta-analysis is that it's the first network meta-analysis in this topic, and we have homogenic populations in our articles, and there are direct and indirect comparisons as well. But in some articles, there were small case numbers and various units of measurements, which could be a limitation. All in all, I should say that the IMF screws and the hybrid MMF technique is more effective in application time, removal time, oral hygiene, and patient acceptance, but there is a higher risk of iatrogenic injuries and inadequate occlusion. So that's why we would like to recommend the wider use of the IMF screws, but we have to talk about the patient from the disadvantages as well. We would recommend multi-param studies in this topic which investigate these techniques at the same time under the same condition with higher case numbers. You can see here my first project progress, and the manuscript is written, and the corrected version is sent to the SMS supervisor, so maybe we can send it to internal review. Our target journal is the scientific reports. My second topic are the maxillofacial injuries related to the e-scooter usage. It's a systematic review and network meta-analysis. So the e-scooters are the part of the urban micromobility because they are environmental friendly way to transport. They are highly available in big cities, for example, and they are really cheap, but there are no restrictions to use them in intoxicated, in alcoholic intoxication, or there's no speed limits. That could be a problem. It's important for us because the most common injuries are face and head and neck injuries, especially in case of young, drunk people at night. So we would like to highlight that danger and identify the risk factors. A clinical question is that what are the risk factors and what is the prevalence of different maxillofacial injuries in adults related to the e-scooter using. We would like to investigate the maxillofacial injuries and risk factors in context of the e-scooter using in adult patients. You can see here my systematic search in 4 databases and my finalized search key. After that, we had more than 1,500 hits, and after the selections and the citation chasing and references, we have now 33 eligible full texts. Now we are in the data extraction phase. And you can see here again my 2 specific goals with the planned submission dates. At first, the effectiveness and safety of the currently used methods in treatments of jaw fractures. Our planned submission date is in September, and the maxillofacial injuries related to the e-scooter usage, maybe the submission can be in this year as well. And I would like to thank you for your attention with the words of Dan Brown, that everything is possible, the impossible just takes longer. Thank you for your attention.
Congrats for your nice presentation. I have a question for your first project. What does cause the difference between the cost in the different countries. For example, the Eric Arch bar in the US around $100. Other author describe only around $50, and in the India less than $10. What does cause this very big difference in the cost? Do you have any opinion? Because that is your either outcome.
Yes, thank you for your question. I think maybe that there are other rights to use these devices. So, for example, in the USA, they have several rights before they start to use some devices. But in India, I think it's a little bit in another way, and everything is cheaper in this part of the world. In this region, so that's why we just would like to see some economic view, but we couldn't make an analysis from them.
Thank you.
Thank you.
Other questions from the audience?
Did I see correctly that you try to investigate 2 pico in your second meta-analysis? So it's just not just a COCOPOP framework, but also a PFO? Because you mentioned the risk factors also. And
yes, we have talked about it, but at first we tried to use the COCOPOP, and now we are collecting the data from the fracture types and that how many patients was intoxicated and so on. So that's why we have chosen that.
So maybe it means that you need to change your Prospero if it doesn't contain it. Okay.
Thank you.
If there is no more question, just one thing that you have a nice picture about these fixations. So why don't you put this picture on every scooter in the street? Because this avoid young people to be a little bit slower.
Yes,
like
we should.
In the cigarette box. Yeah.
And my duties would be better if we do that. So yes.
Okay, thank you very much.
3 days ago, I had a young. So in my duty, I had a young patient who had an e-scooter accident, and he has lost 2 of his teeth, and we have to reponate some. So it would be better if we use this picture.
And he was lucky because it was just 2 teeth, but not the whole mandible or even worse.
Yes, yes, he was lucky.